Hello everyone, my name is Carlos Coulet. I'm an interventional cardiologist at the Cardiovascular Center Aalst in Belgium. Today, we'll be exploring a therapy called the Coronary Sinus Reducer, which has been shown to be effective in the treatment of patients with angina and coronary artery disease, and we're going to learn how the reducer works. Let's begin by understanding what happens in the normal heart during each cardiac cycle. The changes during the cardiac cycle affect how the blood flow is distributed at the level of the myocardium. This leads that the blood flow at the level of the myocardium preferentially occurs during diastole. The myocardial wall consists of two layers, a layer close to the epicardial vessels, or the subepicardium, and a layer close to the cavity, that is the subendocardium. We're going to refer to this as well as either the epi or the endo part of the myocardial wall. The subendocardial layer, being closer to the cavity, is directly influenced by the pressures inside the left ventricle. During systole, pressure rises and it causes a redistribution of blood flow from the subendocardium to the subepicardium, and this generates a gradient of perfusion throughout the left ventricular wall. If we examine in more detail what happened at the level of the microcirculation at the different layers of the myocardial wall, we will see that the subepicardium will have relatively higher amount of blood flow compared to the subendocardium, particularly during systole. Therefore, in the healthy heart, there is a differential degree of perfusion between the subendocardial layer and the subepicardial layer that is driven by the increase in left ventricular pressure. And this differential in pressure across the left ventricular wall also affects the capillaries, which is the place where the interchange of oxygen occurs. Now let's consider what happens in cases of severe coronary artery disease. Any further increase in the intracavitary pressure will compress the subendocardial layer and will reduce the blood flow at the level of the subendocardium compared to the subepicardium. The reduction in blood flow transmits to the capillary level, generating subendocardial ischemia. Now let's compare what happens between the healthy heart and a patient with coronary artery disease. In the healthy heart, there is adequate perfusion both at the level of the subepicardial and subendocardial layer. In contrast, in patients with severe coronary artery disease, there is a significant reduction in perfusion at the level of the subendocardium. Now, what are the options that we have to improve myocardial perfusion and alleviate angina? And we're going to specifically discuss what are the effects of the reducer. To understand how the reducer works, we're going to start by assessing the venous circulation in the heart with a special attention to the coronary sinus, which drains the deoxygenated blood from the heart. The reducer is implanted in the coronary sinus, and after a short period of endothelization, it begins to influence blood drainage. This increase in pressure in the venous system is transmitted to the capillary network in the heart. Now we're going to examine what happens after the implantation of the reducer and what are the consequences of this increase in venous pressure. Basically, if we go again towards the level of the capillaries, we will see that this increase in pressure dilates the vein, improves capillary flow, and improves perfusion. Therefore, the reducer directs flow to the ischemic regions at the level of the subendocardium, improving myocardial perfusion. By directing flow to the ischemic regions, there is an improvement in angina and in patients' quality of life. Thank you very much for your attention.